Hi, everybody. I see some people already hopping on. We're just going to give everyone a couple of minutes right up till 8 o'clock to join us, and then we will get started. All right, well, hello everyone. Thank you for joining. I'm going to go ahead and get started. We're right at 8 o'clock, but we've got a few, introductory things, and that can get us started and make sure we have plenty of time for questions as we go along tonight. Hopefully somebody can give me a chat and let me know that you can hear me okay. And so tonight, we are talking about navigating insurance for applied behavior analysis services. And my name is Emily Roach. I am the VP of Revenue Cycle and Contracting here at Bierman. And we're going to go ahead and get started. So, I oversee our insurance and billing team here at Bierman, and what that means is that our team does all of the intake to set up insurance authorizations and paperwork for families, all the way through to the billing and collections with the insurance company. And if you have services with us, we're the team that does invoicing to collect co-pays. And we also handle the contracts that make us in network with insurance companies. So all of the back end things that fall under working with insurance and being able to use that as a funding source, that's what I oversee with my team. I have been in the industry for 9 years now, always at ABA companies, and I have been at Bierman for 2 years. So this is the first time I have gotten to join these evening presentations with our parents. So I'm excited to be here. I love when people can find the chat or the questions on here so we can be a little bit interactive. I don't always want to hear myself talk for a whole hour. So we, definitely encourage questions and participation, and I can pause for those definitely throughout the presentation, and we'll try to wrap up with enough time for some extra questions at the end. So in this platform, I'm sure a lot of people are familiar with it, but if not, you've got a chat function. You can raise your hand and I can try to unmute you for asking a question, and you've got a Q&A function. So there's lots of options for you to chime in. If you have a question that is really specific to your insurance or a situation with your child, I might try to put a pin in that till the end to make sure that we can get through everything. And I can even follow up with you via email if it's a situation that might be really specific to you, but might not really apply to other people. So I'll try to keep an eye on the time, but feel free to ask any questions, and we can always follow up with those by email or afterwards. All right, so to be a little bit interactive, we've got a couple polls tonight. So we are asking, what is your familiarity with insurance in regards to ABA therapy? And this is great. It looks like everybody is also finding the different ways to participate tonight. So we have mostly feeling not confident at all or somewhat confident. So tonight sounds like will be perfect for the group we have here, because I'm going to go over a lot of the insurance background and how your insurance policy works. So you're in the right place. All right, so tonight I'm hoping that we can understand different types of insurance and your out-of-pocket costs related to insurance. We'll talk about Medicaid as a secondary. We'll talk about accessing ABA services through insurance. Just because you have insurance doesn't always mean accessing the care you need is easy. And we'll talk a little bit about advocating for your child. You know, ABA services or services with Bierman is probably just one step out of many that you might need to take with your child throughout their different ages and lifetimes. So I'll touch on a few other areas outside of ABA or outside of Bierman, and I'll make sure you know how to reach myself and our billing team, and then leave plenty of time for questions. All right, so types of insurance. So as a lot of us know, we've got insurance that is going to be employer-based, meaning that comes from the job that you're working at. Your employer is offering different insurance policies. And a lot of us don't know that those employer plans can have lots of different types. And your employer might only have to offer you one type, so you don't necessarily have a choice. But depending on the type that your employer is offering you, it will change what they're mandated to do. So your employer policy may be fully funded or self-funded. So this changes who is actually paying your claims. So if your employer has a fully funded policy, when somebody files an insurance claim, that means that the money is coming out of the insurance company's pocket to pay the doctor. So oftentimes that might make the insurance policy for the employer and employees a little more expensive because the insurance company is footing the bill when a claim comes through. If it is a self-funded policy, that means that your employer is actually writing the check and paying the doctor through the insurance company, but they actually set aside a pool of money and fund those claims themselves. Now, this can make the insurance monthly premium that you and the employer pay a lot less expensive, but it also means the employer needs to set aside money to pay claims as they come through. And employers might do this because they, have sometimes like a lot younger or healthier, or they're hoping a younger and healthier base of employees. So this can be really common, for example, with like tech companies. We see this a lot, and they are kind of banking on that they have so many employees that they can set aside enough money for the ones who do need to use benefits. They can fund those claims, but in turn, they're making the premiums less expensive. And we're going to talk in just a minute about why those that distinction can impact autism in your ABA services. And then large and small group, small group is under 50 employees, and then large group would be companies that are over 50 employees. And there can be some different laws that apply depending on if your employer is large group or small group. Then you have policies that come off the marketplace, or you can buy them from an individual broker. So some people who are self-employed might purchase off of the marketplace, or we see people with marketplace plans if the employer policy they have doesn't cover ABA services. You can go on the marketplace and purchase a child-only insurance policy that then would get you access to ABA coverage. So we do see marketplace plans for a couple of reasons. And then just for types of insurance overall, we also see Medicaid. Again, we'll talk about that a little bit more detail later. So Medicaid is generally for children ages 0 to 21. There are a few additions to that. And then Medicare is also a public insurance. We don't work with Medicare at Bierman because it's generally for individuals who are 65 or older. So do you know what type of insurance you have for your child? You might have Medicaid. You might know it's an employer plan, but you might not know whether it's fully funded or self-funded, and what that can mean for your services. So it looks like so far we have mostly people who are employer funded. And we'll look at the percentages for what that means for what types of insurance people across the country have. All right. I'm going to actually, these two slides, I'm going to flip the order. So across the US, this is a pie chart. So this right side, when you're looking at the screen that is blue and red or darker blue and red, are fully insured and self-insured employer policies. So about half of the people who have coverage in the United States have that through an employer. And then the other half of the pie is a mix. So we've got a little slice from the marketplace, close to 20% is Medicaid, about 14–15% is Medicare. Military insurance, if you have heard of TRICARE, that is the insurance that covers our military. And then we do have a slice of people who are uninsured. So when you look at the fully insured versus self-insured, you'll see self-funded policies about 30%, fully insured only about 19%. So why does that matter? So ABA is covered in many states because mandates have been passed through the state legislature, and only fully funded insurance policies are subject to state mandates. So those, that 19% that come from your employer and is fully funded, they have to follow all the state laws that have been passed. In the insurance world, those laws that are passed often get called mandated. They're being mandated to cover something like applied behavior analysis. So all 50 states now have either some kind of state mandate or a directive to cover ABA, but that's only telling fully funded policies that they have to cover ABA. Self-funded employers or self-funded policies are only subject to federal law. So even if your state has a state mandate, which all 50 do, your employer does not have to cover ABA services if they are providing a self-funded policy. So they are subject to federal law. There is certain things they do have to cover, but there is not a federal law that requires that insurance cover ABA. So if your employer does cover it, what they have done is they can opt in to cover more benefits than the federal mandate. And that might be a range of things. They start with a federally mandated set of benefits that they have to offer, and then they can opt in to cover anything and everything above and beyond that if they want to. So we will see some self-funded employers who have amazing benefits and opt in and cover lots of different things for their employees. And then we see some self-funded employers who kind of do the bare minimum. So that is why you might end up with a policy that still doesn't cover ABA, even though your state has a mandate for it. And you can find out, you could ask your HR person, or you can just call your member services and find out if you have a fully funded or self-funded plan, so that you would know how your policy is governed if you need to. And there's a link here. We will send the slides out after this. So there is a link here where you can go and see details on the mandates for all 50 states. All right, so some common insurance terms. I'll go through these a little bit faster, and then if you have questions, we can stop and go over one of them, more thoroughly if we need to. So your premium is the monthly payment that you make for insurance. Usually if you have an employer policy, your employer is matching some of that cost. So this is just the monthly payment you make to the insurance company to have insurance. On top of that, then if you have to go to the doctor and use your insurance, you're going to have to pay a deductible and possibly a copay or co-insurance. So a deductible is the cost that you pay in full upfront. We often might see deductibles anywhere from $2,000 up to $8,000. So you would pay every dollar of that initial deductible, whatever the amount is, out of pocket. So if I go to the doctor and that visit was $1,000, but my deductible is $2,000, I have to pay that out of pocket, and probably my next doctor's visits until I hit the $2,000. Once you've hit your deductible, then you just become responsible for a copay or co-insurance. So then you might just pay $20 per visit or 10% per visit until you hit what is called the out-of-pocket maximum. And that is the dollar amount that you would pay out of pocket per year. And then after that, the insurance company will pay 100%. So that's the max you can pay out of pocket. So when you are choosing your insurance policy, and we are getting close to that time of year that a lot of people would have open enrollment and renew their policy, I encourage people to look at this out-of-pocket maximum. If you have family members, including a child or individual with autism, who is going to need some pretty consistent, possibly more intensive services, I would look at that out-of-pocket maximum, because then that is what you will budget for throughout the year if you use your insurance a lot. So if your out-of-pocket maximum is $5,000 or $10,000, that's what you need to plan on. And then after you hit that, the insurance company will pay 100%. And when you're choosing your policy, I would do the math. Maybe you could pay for a slightly more expensive policy and kick up your premium by $100 a month, but maybe that would lower your out-of-pocket maximum by, $2,000 or $3,000 or $4,000. So you might want to do that math, pay a little bit more in your monthly premium, and knock down your out-of-pocket maximum. And then your explanation of benefits, that is the paperwork that you get back when your insurance company pays a claim that shows what they did or did not pay to, whatever doctor or lab or facility that you had to go to. Another thing that is important is in versus out of network providers. So we at Bierman actually have a contract with different insurance companies to be in network. Obviously, that is a big term that we hear a lot because insurance companies come to a contracted rate that they pay the provider. So it's agreed upon and there's no surprises. And that overall usually lowers the cost a little bit for the insurance company if we agree to, a mutual rate. The insurance companies often don't like to pay for out-of-network providers because they don't have a contractual rate agreed with that provider. So that provider can just charge them whatever their, usual and customary rate is, and they have it agreed to a discount for being in network. So, and in and out of network can be tricky depending on where you live. For example, in Indiana, where Bierman is, we are in network with some of the insurance companies that cover Medicaid, but not all of them. So we're in network with, for example, MDYs. They're one of the MCOs, or one of the insurance companies that administers Medicaid, but we're not in network with Anthem's Medicaid plan. They won't let us in network. They say, we have enough providers, our network is full, we don't want to let anybody else in network. So it's not always a given if you're looking for a doctor. If they are not in network with your insurance, maybe they can't get in network with that insurance. A non-covered benefit. So if ABA is not covered on your self-funded employer plan, there are things, that are non-covered benefits. So you might hear that term. If you have two insurances, one insurance has to be primary and one insurance has to be secondary. So even if it's two commercial policies, let's say we have two parents, one parent, has insurance through their job, they put the child on that insurance. And then the second parent also has insurance through their job and they sign up and put the child on that policy as well. So this child is covered under two insurance policies. One will always be primary and one will always be secondary. If you have employer insurance and Medicaid, Medicaid is always the secondary insurance. It's called the payer of last resort. And you, as a provider, we always have to bill the commercial insurance first. As the member, you can't choose which one is primary, which one is secondary. There's rules that govern which one is supposed to be primary, like Medicaid always has to be secondary. So please, if you are signing up for services with any doctor or coming to Bierman, you need to let us know if you have more than one insurance policy, and you need to let us know which is primary and which is secondary. And if you don't know, we can help you with that. But if your provider doesn't know about one of your policies and doesn't bill for it, that can cause a huge mess where that insurance company, when they find out, hey, this member has another policy, they might reverse all the claims or take their money back. So it's really important for you to help your provider keep that information correct according to the policies you have. And when you have a secondary insurance, usually what that can do is cover your out-of-pocket costs. So we talked about that deductible and copay. If you have Medicaid, we as the provider would then take your $5,000 you would owe for your deductible, and we would bill it over to Medicaid, and they would cover most of that. So when we talk about primary and secondary insurance, and one has to be primary, one has to be secondary, that's called coordination of benefits. And that's something that you as the member have to take care of. Usually your insurance company always sends you paperwork or asks you as you're signing up, do you have any other insurance policy? Do you have any other coverage? And this is why, because they want to know, are they a primary policy or are they a secondary policy? And then a few other things you might hear is you start actually accessing services. So a primary care physician or your PCP, even if you have an insurance policy that doesn't require you to choose a PCP and declare who they are, which I think Medicaid often does, but another commercial policy, they might not care who your primary care physician is, but if you're trying to access specialty services or behavioral health like ABA, they will want that primary care physician to refer you or your child for those services. So we actually have to have a referral, a physical piece of paper referral on file from your PCP, often if you're going to access speech or OT services. So an occupational therapist or a speech therapist in a lot of states, their license actually says you can only practice or see a patient if a doctor, an MD, has said this patient needs that care and referred them over to you. So if you would want occupational services with us, you might have my team coming to you and saying, hey, we need a referral from your primary care physician for occupational therapy or for speech therapy. You may see benefit limits or caps. This is really decreased in recent years, that insurance companies are allowed to limit or cap a benefit, especially a benefit for treating a diagnosis that is categorized as a mental health condition. There is a law that says mental health conditions have to be treated equally and fairly in comparison to a physical condition. So we're starting to see a lot of the limits or caps get removed because insurance companies often aren't supposed to be doing that. But you might have a policy that says, you can have speech therapy, but you can only have 30 visits per year. So we have to watch out for that. And we check that during the intake process. Another thing you'll hear a lot is this term medical necessity. And the insurance company will only want to pay for services that have been deemed medically necessary. So again, they might look at this primary care physician or maybe a physician that did some kind of diagnostic testing and say, well, is the service that you're trying to access, has somebody who's a professional said it's medically necessary for you? So we'll talk about medical necessity and diagnosis a little bit more as we go. So I should have clarified earlier that all 50 states do have some kind of state mandate or directive that applied behavior analysis has to be covered. However, almost all of those state laws also say the insurance company only has to cover it if it's an individual who has been diagnosed with autism. So it is important that you have official, I guess not official, but approved diagnostic testing done by, usually a psychologist, maybe an MD that has some kind of developmental specialty, maybe a developmental pediatrician. So you do have to actually go get the testing done and have a diagnostic report that says my child has autism if you're going to be able to access services, because the laws say it's medically necessary for a child with autism. And in some states, Medicaid does not require an autism diagnosis, but would still require a referral or a report from your physician explaining why the services would be medically necessary. All right. And hopefully I'm covering some new information. Again, if you want to put a question in the chat, I can always pause to answer those. All right, so I want to talk about Medicaid for just a minute. So who is in charge of Medicaid? So there is a federal department called the CMS, the Centers for Medicaid and Medicare, and they are in charge of laying down the rules for how Medicaid and Medicare work. What the federal government does is they say, here is the basic template, the basic criteria you have to meet, and then they let all 50 states then develop their own Medicaid department to administer that program how they see fit. So if you move from one state to another, you might see that the Medicaid program looks a lot different. Now, again, there's a basic set of criteria that they have to be doing, but you know, it can vary. Maybe you go do your Medicaid application through the state, and your Medicaid comes from, you know, the state of Colorado, or maybe the state uses the insurance companies basically as the middleman to administer Medicaid, and you might have a Medicaid card from Anthem or a Medicaid card from MDYs. So each state gets to come up with their own rules, so that's going to look a little bit different if you move around. The Medicaid program will have state benefits, and then with working with children with developmental delays or autism, we have often seen waivers come into play. So when we talk about state benefits, when the state says, okay, here's how our Medicaid program is going to run, they come up with their basic comprehensive list. I guess they come up with their comprehensive list of what's going to be covered. And so in some states, ABA services are a state benefit. It's written in that anybody who signs up for Medicaid, ABA is one of those benefits. It will be covered, and you just have those services covered through a traditional Medicaid policy. In some states, ABA has not yet been written into that state plan, and you, as you're signing up for Medicaid, would be signed up for something called a waiver. And what the waivers do is they say, okay, if something is not included in our whole list of state benefits, but people really still need this service, maybe we can create a waiver that would fill that gap. So depending on the state you live in, you may have heard of a waiver. You might have a waiver already. So basically you would have one or the other covering each service that you access. It's either under the state benefits, or if it's not, then you might be able to access it under a waiver. A side note, so a little different from Medicaid, there is also something called CHIP Plus, or the Children's Health Insurance Plan. It's a state-funded program that helps catch kids who are in between. So parents maybe don't have a way to cover that child on an employer plan. Maybe they're self-employed, you know, and a family policy is really expensive. So one option would be to purchase a CHIP plan for your child. And maybe in your state, you don't qualify for Medicaid, whether that be because of income thresholds or because of the diagnoses that your child, you know, does or doesn't have. So maybe you can't qualify for Medicaid. You don't want to use a marketplace plan or employer plan. There's often this plan that fills the gap called the Children's Health Insurance Plan. And that was to ensure that children never go uninsured. So a CHIP plan is something else that you might be able to purchase for your child if you don't have a good employer option, or maybe if you don't have insurance through an employer. And then where is Bierman able to accept Medicaid at this time? So we do participate with Medicaid in a couple of locations. In Massachusetts, the insurance company that covers the Boston area is called MBHP, Massachusetts Behavioral Health Partnership. So since we're in the Boston area, that's the one that covers that area. So we are in network with MBHP. And then in Indiana, we are in network with traditional Medicaid, and then also with two of the insurance companies that cover Medicaid policies, MDYs and MHS. So you would have to be on one of those three policies in Indiana for us to be able to take Medicaid for you. All right, and then who can access Medicaid? Again, most often it's for children ages 0 to 21. There are some other, adult programs or programs for individuals, adults with disabilities, that you may actually qualify for Medicaid. So that is something to be aware of. As your child gets older, a lot of times at Bierman, we are a early intervention provider. So we often don't see families transitioning into those adult or young adult services, but there are options out there when you get to that point. And then each state does have income thresholds. So if your income is usually below a certain amount, you can qualify for Medicaid. Some states have what's called a buy-in program. So maybe you are above the income threshold, but they might say, okay, you're above the threshold to qualify for Medicaid, but if you only make up to X amount of dollars, then we'll let you purchase Medicaid. And usually that's a much less expensive policy than something like through an employer. So you might be able to buy into Medicaid for your child. And then some states, like we said, have waivers. And some states also say, when we have individuals in our state who have certain diagnoses or certain medical needs, we know they're going to have a lot of medical expenses. So we're going to throw out the income threshold and purely look at their medical need and let families qualify for Medicaid just based on their medical needs. So there's actually a law called TEFRA, and it's something about a tax equity, something reform act. I can't remember the whole acronym, but you'll also hear people call it the Katie Beckett waiver. The first state that passed this law that said, okay, even if you're over an income threshold, your child still might really need Medicaid. The parents of a girl named Katie Beckett helped pass that law. So TEFRA or Katie Beckett, here's a link if you are in another state or moving to or from another state where you can see the whole list. But we have that law in Massachusetts and in Rhode Island for the states where Bierman provides services. So in Massachusetts and Rhode Island, it doesn't matter what your income is, you can qualify for Medicaid based on the medical needs or diagnosis of your child. All right, accessing ABA through your insurance. So when you go to an ABA company for intake, we will want to verify your benefits, and a lot of families do, through employers now have ABA benefits. So the next step is, how do we actually get approval to access those services? So my team deals with paper, and more paper. We have a lot of different pieces of information that we have to get from you during intake that's required by your insurance company. And then there's other clinical things we have to submit to them as well. So one of those really important documents is going to be your diagnostic report. So anytime you go to the doctor and you get some kind of diagnosis for your child, I mean, for yourself as well, but for your child, make sure that you are getting a copy of that from the doctor and getting it in a format that you can easily access, whether, you know, they tell you it's in a portal or they hand you a copy of it. That is something you're probably going to need over and over to give to your insurance company to say, yes, these services are medically necessary because my child has this diagnosis. Again, you might need a referral. So the insurance company might tell us, the provider, or they might tell you, hey, you have this service if you are referred for it. Sometimes we might ask for a prescription or a script from your PCP. That is often an additional layer of paper saying, yes, this is medically necessary. So if your primary care physician is not the one who did your diagnostic report, which is common, sometimes we get a script from your doctor that says, yes, ABA is necessary for this child. And then when we have all this paperwork, we go to the insurance company and we have to get an authorization. I would say 99% of the time, insurance companies require an authorization for ABA services. So we have to submit paperwork to them saying we want to provide ABA services to this child. We usually have to get an authorization just to do the initial assessment with you, and that will generally cover about 8 hours of services, and then for us to write our treatment report or treatment plan. And then we have to get an additional authorization to provide your ongoing services. And usually we have to renew that every 6 months. Authorizations and appeals. So when we obtain authorizations, like I said, we send different documents to the insurance company: your diagnostic report, our treatment plan, the testing scores that we did, the data we've taken while providing treatment to your child. So we send that all to the insurance company for them to review. And for you to be aware, insurance companies sometimes ask for documents that they're not supposed to ask for. So we see insurance companies try to ask for things like your child's IEP, or they want to see IQ testing done, or they want an updated diagnostic report. Oftentimes they're asking for these things to try to throw up barriers to prevent you from accessing services. They want to reduce the number of services they have to pay for. So if your child is old enough to go to school or is getting there and they have an IEP, the insurance company might say, oh, well, the school is providing, you know, X number of hours a day of services, and they're at school for 8 hours a day. So we, the insurance company, should only have to cover about 1 hour a day of services. So be wary if your insurance company is asking for additional documents, because there are laws that often protect consumers that say they don't need to know what you're doing at school because they're providing a medical service. So it doesn't matter what you're doing at school. You don't have to turn over that IEP. And when we're turning in all of this documentation, what we are trying to show the insurance company is that the services are medically necessary and at what intensity services are medically necessary. So we see this term thrown around a lot, and I put the definition here. Again, it's kind of long, but you'll get the slides. And I put that here because what insurance companies will often do when they're denying services is they will be very, very vague about why. So they will just say, we found that it's not medically necessary. And they don't put any clinical justification as to why they found it's not medically necessary. So a lot of times that causes confusion for families or for providers, because we're saying, well, how do you define medical necessity? What is it? So it's not that it has to be a big mystery. It's that usually the insurance companies try to use that term as this vague catch-all to say, I'm denying it because it's not medically necessary. And really, if you read the definition, you would find that ABA at some level should always be deemed medically necessary, or almost always, I would say, for a child with autism. If you have an ABA provider who's saying, yes, this, will be beneficial, they're saying that there's a professional exercising their prudent clinical judgment that would be provided to a patient for the purpose of preventing, evaluating, diagnosing, or treating an illness, injury, or disease and its symptoms, and that are in accordance with generally accepted standards of medical practice, clinically appropriate, and not purely for convenience. So that's not, a terribly high threshold. That medical necessity is a super complicated thing. It basically says, did a professional who's working within their scope say this is necessary to treat the diagnosis that you have? And would other professionals agree? So, so that if you run into denials, that is something that might be good to know. Another thing that I mentioned earlier, so we have a federal law called the Mental Health Parity and Addiction Equity Act. People will call it MAPIA. And this federal law is really powerful. And it says an insurance company has to treat any diagnosis for a mental health condition equally as they would a physical condition. So we often have pushback from insurance companies with mental health diagnoses like autism, saying, well, this child's been getting ABA services for 3 years. Maybe it's time to stop. They've been getting services long enough. But as we know, autism right now, isn't cured. The child still has that diagnosis, probably still has some needs for that care. And the insurance company, if we compare it to something on the physical side, which is the whole crux of this Mental Health Parity Act, that they're supposed to be treated equal. Let's say somebody's diagnosed with type 1 diabetes. That is a chronic condition that there's no cure for. And I guarantee the insurance company isn't saying, you know what, we paid for your insulin for 3 years, so now we feel like that was enough. You should be done with treatment. So if they are trying to impose ambiguous cuts and denials in services, they're probably breaking this federal law. And then if you do have to do an appeal because you got a denial, your provider should write that appeal and provide clinical support. But often we will work with parents, and sometimes it just means you have to sign a form that says we can do the appeal on your behalf. But we do that because members, individuals receiving care, the ones who have the insurance company, you're the member, we're the provider. So members have very strong appeal rights under different laws, including the right to go to an external review. those laws specifically protect members and name members as the ones who can use those protections. There are not nearly as many protections for providers. So if you do have to work through an appeal with your provider, they will probably need some support from you because you're the one who has all the protections to go through the appeals process.
Emily, before I launch the poll, Melanie had a question in the chat. Can employers opt out of the Mental Health Parity Act like they can the state mandates?
That's a great question. So the answer is no. It's a federal law. So nobody can opt out of it. But usually the ones, so your employer might have things in your policy that would violate the federal mental health parity law, or the insurance company could be imposing some kind of limitation that would violate the law. So it could be from your employer. Something I have seen, for example, there was a group of families that worked for this one employer, and they were capping ABA at 60 visits per lifetime. So that's not nearly enough. And they were not doing that to any other like physical care benefit. So that employer was violating the mental health parity law. And that would include self-funded policies. They can't get around it. And then you could also have an insurance company that would, like I said, start trying to like deny or cut hours and say, oh, we've been doing this for 3 years, or oh, your child should be in school, or they're too old. So the insurance company might start trying to impose reasons like that to cut back care. So both the insurance company or an employer could violate that law. And depending on, where you're at with your care, you may have run into these issues, and maybe this is new to you. So that's our next question. Have you had an insurance try to deny medically necessary services? And unfortunately, a lot of people are saying yes. Very few people or nobody has just said no so far. I mean, this is really common, and it's really hard and really time consuming, and you have to learn about laws. It can be confusing. But hopefully as you go through accessing services for your child, you can partner with providers. And I'll also have a slide with some other resources that if you are having denials and issues, that will hopefully help you navigate and fight back and either work with your employer or work with the insurance company to either win that appeal or get them to knock it off. All right, so advocating for your child. So here's just some things that we see with specifically children with autism. Again, your diagnostic report is really important. Insurance companies are getting more and more aggressive about like hinging your care on the diagnostic report. So be sure when you get that report from the doctor that it clearly states what your child's diagnosis was, what testing they did, because if they don't do a good job with that, unfortunately, as you go through years of trying to access care, you might end up having to go back, not because your child's diagnosis has changed, but simply to get a better diagnostic report, just that written paper, to show the insurance company, hey, this is something that is necessary. Be willing to call your insurance company as you're starting out. It sounds like some people have already been through denials, so you have maybe already been through this. Maybe it's new for you, but if we're really having a tricky policy, something that I do and my team will do is get on a three-way call. So us with the parent and the insurance company, because again, you're the customer of the insurance company, so they care about pleasing you. Oftentimes they don't care what the doctors or the providers say. So we encourage parents to be empowered and be proactive and feel comfortable. Call your insurance company and say, hey, why are you denying this? This is inappropriate. You have no justification. I want this approved. And sometimes a call from you can be much more powerful than, several calls from me. Know who to speak with at your employer. So oftentimes employers want to provide you a benefit that you can actually use. So we have seen, let's say the employer has opted in and said, we do want ABA services covered. And then the insurance company is denying and making you jump through all kinds of hoops. Sometimes the employer doesn't know that that's how that insurance company administers mental health benefits. So you can go to the benefits administrator at your HR department and say, hey, we're trying to work with, Blue Cross Blue Shield or Aetna, and I can't get access to this benefit that you're saying you want me to have. So sometimes that can be really helpful. And then as your child gets to be school age, there is a big difference between the educational versus between educational services versus medical services. So you will potentially have IEP meetings. Your child might need an IEP or a 504. There are groups out there that provide school advocacy and special ed law. There's a whole host of very intense and specific laws that are supposed to offer protections for individuals who need to be in the special ed or need to be accessing services through special ed. So that's not something that we specialize in, but I just wanted to touch on that because depending on the age of your child, there might be, this kind of partnership between the services that they're getting through school and the services that they're getting around school through their medical care. And then you can always ask questions about other services that your child needs, throughout the years. We, again, at Bierman, we specialize in early intervention intensive services, but as your child gets older, I've worked at other agencies that provide things like social skills groups. We've seen kids who have augmentative speech devices, and you can sometimes get those paid for through insurance. As your child gets older, you might need respite care, you might need transportation. So learning where those resources are as you go is really important to ask for what you need, because sometimes there's coverage out there for those services or different programs that help offer it or grants that might cover it. So I would encourage you to be open-minded about what you need and maybe finding ways to access those different things. So in different states, you might have a chapter of the Autism Society or the ARC that are really active for individuals with developmental needs or specific to autism. And that varies by state. So I know like in Indiana, both of these are actually pretty active. They offer workshops for parents. They offer like social activities for kids and young adults. So I would encourage you to find out, what is happening with these groups in your state if you haven't already. And sometimes even in your city, depending on what state you live in, there might be multiple chapters. I think Bierman is actually attending an Autism Speaks walk in New Jersey this week. And if you've never attended an Autism Speaks walk, that's another thing I would encourage you to look at, because when you do the walk, there's usually a bunch of different, tents set up that have providers that provide services, or just groups that provide camps or fun activities for kids. So that can be a really neat way to go out and see what else is available in your community. There's a resource guide. So the Autism Speaks website, I put a couple links on here. So one of the links just lists like a whole bunch of different things in each state. So whether you're looking for a school or an ABA provider or a psychologist or a camp, they have compiled a bunch of different resources by state. And then they also have a page for grants. So if you maybe need some assistance, either with something that's not covered by your insurance, or there are some grants that will help cover like deductibles and copays. So there's some great links on there. In Massachusetts, there is a group called the Autism Insurance Resource Center. They are located in Massachusetts, but even if you're not in Massachusetts, I would encourage you to reach out to them, because whether you have insurance through Cigna or Anthem or United, that insurance is operating the same in Massachusetts as it is in other states. So if you're not in Massachusetts, I would still encourage you to reach out to them if you have some insurance questions or issues. Amy Weinstock, who runs it, has been in the industry for years, and she's an amazing advocate. Here's a great link for a neat parent training and support website that was started by an MD. There's a Spanish version on it, which I also think is great, because that can unfortunately be hard to find. And then this Rights Law website is a big go-to for special ed law. They have books on there that are broken down into digestible topics for parents. I've taken a class on special ed law, and it can be pretty overwhelming. So this Rights Law website has some really neat stuff. So I want to keep an eye on the time. It has been an hour. So I'm going to put this slide up for just a minute. If you are in the process of accessing services with Bierman, you can always get in touch with our insurance team. Or if you're just considering services and you're like, I have no idea if my insurance is going to cover this or what that will look like. Our team is, everything now is remote. We are actually located in Indiana. We have 12 people on the team. So if you're in one of our other states, it might feel like we're far away, but we are, I promise, like a very personable, tight-knit team in Indiana, and we're here to help. Our billing manager, who actually handles like your billing and invoices, her name is Joe Thomas. And then our insurance manager, who helps with the intake and authorizations, her name is Sarah Liston. So you can always contact us. And then I think we have some quick information to wrap up, and I am happy to stay here and answer some questions if anybody wants to get those questions put in the chat.
Yeah, Emily, I can just cover this real fast. So our webinar, we will send you guys the slides either today or tomorrow or the next day. And then our previous webinars are also on our Bierman YouTube channel. So we'll also send you a link to that as well. We do have a webinar in November that's coming up in 2 months, and it's the introduction to ABA, and it's also at 8 p.m. Eastern Standard Time. So that'll be in the slides that we send. That's all the housekeeping stuff I have. I will turn it back over to Emily for any questions that you have.
And my email, I realized I've got it on 2 different slides. My email is on this slide. You know, and again, our insurance team, I get that as well as our managers. So that's a good way if somebody's busy for us to, you know, get an answer back to you, hopefully quickly. But if anybody wants to chat a question or feels brave enough to come off mute and ask a question, I am happy to stay, or you can take down my email. And if you think of something, you know, in the next couple of days, you can let me know. All right, and if there's no questions, thank you for taking the time. Hopefully that was helpful. And, you know, as Travis said, we've got some other great topics coming up.
Thank you so much.
All right, thanks. Good night.